Hi everyone. Hi there. Hi Virginia. It's a big pleasure to meet you again for this new episode. During this web series, we will talk about innovative and disruptive healthcare solutions, and more precisely, how to use artificial intelligence to live longer and especially better. My name is Perez. I'm a strategic expert and author in health and aging solutions, and I'm also a French representative for EIT Health Innovators Community, supported by the European Commission. And EIT Health Innovators Community is a large European network offering a lot of business opportunity and access to a large amount of tech events. And speaking about tech events, I would like to invite you at Silver Echo Festival held in the south of France in September. And any entrepreneurs, institution, and big companies will receive a 20% discount on booth reservation at this festival, thanks to our partnership. Also, and as a partner of the MedTech World event to be held in October in Malta, we have free standard pass and 25% off on every type of pass, startup pass and platinum pass. So if you are interested in participating as a VIP guest, for example, or in booking the booth for your startup, please to let me know at the end of this web series. And now it's a real pleasure to welcome here today Virginia, who's a doctor of physical therapy and AI enthusiastic. She is also a friend of mine, and she's a former participant of a past EIT Health summer school called Mobility and Antiaging. She will tell us about her experience as a doctor and his feeling about how artificial intelligence could be used in order to live longer and better. So if you have any question for Virginia or for me, please to put them in the chat and we will answer them just after Virginia's presentation. Before giving the floor to Virginia, I would like to say that a lot of longevity sciences are about technology and are about health. And artificial intelligence is maybe this amazing tool to prevent or to predict a lot of diseases like cancer or cardiovascular diseases. And AI is a fabulous tool for that. With AI, we can spot a lot of patterns to understand the disease and to provide the right treatment for the right patient. AI is about also, when we talk about longevity, it's about also rejuvenation to stay younger. And it's maybe for now not a sci-fi, And to conclude, AI is also efficient for longevity research and longevity studies like Virginia will talk about us. So now, to answer this question, I will now give the floor to Virginia, and I hope some clarity will be given about this subject. So, Virginia, it's your turn.
Yeah, good morning, everyone. Thanks, Lucas, for the introduction. I'm really excited to talk about AI in longevity. I've been a great enthusiast in the field for a few years, and I've been working in the longevity field for nearly 10 years now. So yeah, let's start here. I'll share my screen. All right, so I would like to start here asking the question, what is longevity? So I asked two artificial intelligence for definitions of longevity, and they seemed pretty accurate to me. I just asked ChatGPT and also Microsoft Bing AI that's connected to the internet. They basically gave me the same definition that longevity is to live long. We can all agree that longevity is good, but at the same time, when you talk about increasing lifespan, we should also take into consideration increasing health span. And we see that global trends show an aging population. People are living longer in all regions of the world. And modern medicine has been successful in extending lives, but there's a huge increase in healthcare costs and a big burden in the healthcare system because despite life extension, wellness and quality of life for older adults have not improved correspondingly. So researchers are now discussing the path of future research, especially with the advent of AI, questioning targeting disease versus treatment of disease. Targeting aging may extend the prevention or treatment of disease, and that's because the aging process has several age-related disease, mainly chronic disease. However, within the established drug discovery and development framework, the pharmaceutical companies are still searching for compounds and interventions for the treatment of individual disease, mainly cancer or cardiovascular and pulmonary diseases, even diabetes as well. So I think the idea here is to follow the neuroscience hypothesis that's addressing aging physiology will allow a reduction or delay in the appearance of multiple disease. The hypothesis states that if the deterioration mechanisms common to many or most tissues are known, therapeutic strategies that target those processes could alter the course of aging and have beneficial effects on the incidence or progression of multiple age-related disease. So I think that the idea now is, understanding why the aging process happens and not what happens. I think they know what happens in the aging process, but why? And then go for that so it's possible to avoid all the chronic disease related to aging. So let's talk now about artificial intelligence here. I will highlight some definitions of what artificial intelligence is, especially because we're talking to the healthcare field and maybe not everyone knows the concepts. So here, artificial intelligence, the ability of a digital computer or computer-controlled robot to perform tasks commonly associated with intelligent beings. And within artificial intelligence, we have machine learning. That's a subset of artificial intelligence that's particularly focused on developing processes by learning from historical data and responding to new data. And then within machine learning, we have deep learning. That's a subset of machine learning algorithms that's based on artificial neural networks. And artificial neural networks can learn complex tasks in a variety of domains. So in the longevity field and really overall healthcare field, AI has been used machine learning and mostly in 4 ways. The first way is the supervised learning. It's when the algorithm finds the relation between input and output data while training the system. Then we also have the unsupervised learning. That's when the algorithm finds patterns and correlation between unlabeled data. Then we have the semi-supervised learning. That's a combination between the supervised and unsupervised methods. And then finally, we have the reinforcement learning. That's when the algorithm makes decisions that would maximize the reward or minimize the risk. So here, I will talk a little bit about the artificial intelligence advancements in the longevity field. So here are some databases for deep learning for aging research. So the acronym here, HAGR, stands for Human Aging Genomic Resources. That's a collection of databases and tools designed to help researchers study the genetics of human aging. And this big database hosts several other databases, such as the Cell Age. That's a manually database of genes associated with cell senescence. And their data comes from gene manipulation experiments in different human cell types. Then we have the Longevity Map. That's a repository of genetic association studies of longevity, which aims at aggregating the current knowledge of the genetics of human longevity. And then we have the Gene Age. That's a benchmark database of age-related disease. In addition to that, we have the Geroprotectors. That's a database of geroprotectors. Geroprotectors are agents that slow down the aging process. And this database contains more than 250 life extension experiments in 11 wild type model organisms and data about more than 200 chemicals promoting longevity, including compounds approved for human use that are available as well. And then finally, we have the aging portfolio, which is not a database for deep learning, but it is a database to track the progress in aging research. And this database is especially interesting because it will suggest future research and kind of like give guidance to the researchers in what needs to be studied more. Here are some applications of artificial intelligence in aging research are basically in two main fields, it's the aging biomarker discovery and personalized medicine. So biomarkers of aging are tools able to provide a quantitative foundation to evaluate the therapeutic efficacy of clinical health extending interactions. Precision medicine is dependent on robust quantitative biomarkers. And most of the advances in deep learning in the context of aging research are in the field of biomarker development. However, the design of such biomarkers from an experimental point of view is time-consuming and tedious. It's a very long and slow process that includes proof of concept, experimental validation, and analytical performance validation. But with AI technologies now, there are alternatives for the development of aging biomarkers, and deep learning-based aging clocks have already been used to identify quantitative biomarkers. I'll talk more about aging clocks just in a minute. So here we have more applications of AI, and this is a field called longevity medicine. It's a branch of precision medicine that's specifically focused on promoting health span and lifespan, and is absolutely powered by AI technology, which will facilitate the discovery of drug targets for specific individuals, also the identification of tailored interventions and longevity biomarkers to enhance the study of aging disease, aging and disease trajectories, actually, possibly helping to slow down or even reverse the aging process, not only biological, but also physiological and psychological. So this image here shows a deep generative reinforcement learning for every aspect of healthcare at every level of system organization. It's a big application of deep learning in the clinical practice. And deep learning was a breakthrough for AI research, really, allowing for the training of deep neural networks on massive longitudinal data sets that was previously almost impossible to comprehensively mine and interpret such big data in the longevity field. So here are the aging clocks. So the deep aging clocks, the acronym is DAC, they estimate biological age from biological data ranging from clinical blood tests, photos, videos, voice, retinal scans, medical imaging, even microbiome data. And that's all to perform linear or non-linear regressions for estimating the chronological aging of a person. So the training protocol of aging clocks will try to minimize the difference that's called aging acceleration between the physiological age that's estimated by the model and the actual chronological age of the individual. And here, some research from 2019 showed that patients that showed physiological age higher than chronological age were increased prevalence of showing hypertension and cardiovascular disorders, chronic inflammation, anemia, poor nutritional status, kidney failure, liver damage, and also other factors that are not included in this research, but we know that can also lead to dementia, cognitive decline, and possibly lead to Alzheimer's and even Parkinson's disease as well. So now researchers argue that the deep aging clocks should become an essential part of a physician's toolkit, enabling artificial intelligence to support the recommendations to promote long and healthy lives. So imagine going to the doctor and they can accurately tell you what is your physiological aging, and then basically help to tailor the treatment for you. So here is an example of how deep aging clocks work using AI. So first, samples of people exposed to anti-aging treatments or drugs can be used as inputs for aging clocks. And then you get estimations of aging acceleration. And then you make comparisons with non-exposed samples to give a first estimation of the effects of these treatments. And then you have another approach that relies on the use of AI to extract features characterizing the optimal health state reached by most individuals ranging age between 25 and 35 years old. And then computational analysis can track how these features are affected by various treatments, such as the use of geroprotectors that can be metformin, melatonin, rapamycin, and also inputting data from lifestyle habits like lack of sleep, sedentary behavior, drug abuse, poor nutritional status, etc., etc. So another use of deep aging clocks is with small molecules drug discovery. So computational techniques are developed for the design of drug compounds and for generating large virtual chemical libraries that can be more efficiently screened for in silico drug discovery. And drug discovery and development timelines can be further optimized using deep learning and AI technologies to characterize drug candidates according to likely efficacy and safety prior to preclinical and clinical trials. That would save a lot of money and time trying to avoid going to all these clinical trials. So the disruption of the standard discovery pipeline through AI technologies will be beneficial for the identification of new candidates for developing new anti-aging therapies. So here we have these diagrams. On the left side, we have artificial intelligence de novo molecular generators that offer interesting opportunities to optimize the identification and selection of molecules with desired properties. However, a systematic use of such approach requires the establishment of standardized procedures and protocols for the training and validation of the model. So it's not that simple. Furthermore, systematic studies could be performed to better understand how the model will work depending on the specific architectures, loss functions, and combinations of all the filters that are used. And then here on the right side, we have the AI molecular generators that are best used with aging clocks. So targets identified from aging signatures and features used by aging clocks are used to define appropriate properties of molecules generated by the AI generators. So as for many computational methods, predictions obtained from the AI-based generations must go through various phases of testings, and the feedback obtained from these critical steps can help improve the global pipeline. So here's some other applications in anti-aging treatments. It's well known that there are many mechanisms contributing to aging, including inflammation, apoptosis, oxidative stress, accumulation of DNA damage, mitochondrial dysfunction. And I think that the most common one that people know is the telomere shortening. You know that throughout the age, you decrease the size of your telomere. Gene therapy is trying to work on increasing the length of the telomere. And then we have the regenerative medicine using stem cells, embryonic and pluripotent, to regenerate tissues, especially for neurodegenerative disease such as ALS or MS. And then we have immuno-oncology, trying to understand the overgrowth of cells or the disorganization of the cell growth in the organism. And then personalized medicine that we all believe that's the future. All patients will have access to personal treatment. So here is an image talking about the use of artificial intelligence for personalized medicine. So it can be different ways for designing personalized treatments. The AI platforms can be used as diagnostic tool to reduce error rate. It's also useful to stratify patients according to their specific health condition. And then by combining more accurate diagnostics and a better knowledge of health conditions of the patients, AI platforms can be applied to design more effective treatments. Here are some opportunities for longevity medicine in clinical care and the longevity industry. So what researchers are saying now is that aging needs to be monitored and treated as a medical condition. if you understand that the aging process will cause all the chronic disease, you must target the aging process and not treat the consequence that are the disease. And then there's a need for the physician involvement in the artificial intelligence-based longevity research. It should be encouraged. And doctors first need to have access to tailored, validated, credible education on AI-based biogerontology sciences, such as accredited courses that would further allow longevity physicians to build their own networks and ultimately create a separate medical discipline. Basic knowledge of AI-driven neuroscience is essential at the moment to bring relevant scientific discoveries. So that's really important to start to connecting both the research field and the clinical field and teaching the doctor what AI can do for the longevity field. So here I'm going to shift gears a little bit and talk about wearable technology. That's application of AI into the field of rehabilitation and quality of life. So wearable technology is really interesting because the sensors can work outdoors. Until a few days ago, we just had the setup of the lab at the university where you have the cameras and you can only measure data from one person. It generates big data that you have to analyze later, and it's really expensive setup to have. And with the wearable sensors, that's affordable, that's practical, and you can use basically at any place. You can track many people simultaneously. And then we have the smart clothing that's basically fabric that conducts electricity, and then you can extract a lot of data. So the smart clothing, we have several things going on in the market at the moment: smart watch, smart bracelet, smart shirts, even a smart ring. I never met anyone who has a smart ring. I don't know how that works exactly, but we have all these devices that are wearable sensors and can track data. Here we have some illustration from research from 2018, which the researcher developed a shirt that could track motion and could track data, and it was able to tell if the person was inactive or active. And if the person was inactive for long periods of time, then the shirt would send signals telling the person to start moving. And if the person was moving, the shirt would also send signals to tell the person, give positive feedback that was the person was doing well. So even during a squat movement where there were minimal signals from the accelerometers and gyroscopes, as the feet was mostly stationary, the deep neural network embedded in this system was still able to predict the movements of the hip and knee using data only from the pressure sensors. So that was really interesting. And a limitation from this study that they called attention to is that in order to produce these garments, so people can use that on the streets, it's just expensive. It's not affordable to buy the textile and commercialize. And the prototypes really feel like bullet-proof vest because they're super heavy with all the sensors, and that can even compromise the quality of the data because the person is using something that they don't feel comfortable, and they might change their posture. Their normal posture or their normal behavior can change, so you can have false data. So the idea now it's to have new companies working on the quality of the fabric for e-textiles. It's an opportunity for new startups in the healthcare field because they want to commercialize the smart clothing, and it's not yet. Here's just some citations of the algorithms and technology used for testing and measuring the comfort of the e-textile. So basically, it has to feel silky, smooth, lightweight, so the person can use that to go to the grocery store, go to hang out with friends, go do activities, and feel comfortable to have their data tracked full time. Here we're going to talk about computer vision. So computer vision is a field of artificial intelligence that enables computers to see, observe, and understand the visual world using digital images or videos. It uses machine learning and artificial neural networks to identify and classify objects and take actions or make recommendations based on that information. So me, particularly, I'm very interested in the technology of computer vision because I'm a physical therapist. And then every time I'm going to go see a patient for the first time, I need to do a first assessment. I need to measure the range of motion. I need to measure their balance. I need to measure stability. And that takes time. That takes hours. And depending on the severity of the injury or disease, it can take days. So many tests that we have to run and then put the scores manually, and the computer vision can just optimize everything. It can just take from your smartphone, from a camera using your smartphone or laptop. You can measure the range of motion, and that can be automated. It's very interesting technology. So here is just a picture showing how the computer vision works. So there are applications now that you can track posture and analyze posture distortions and misalignment. So we can see here in the green line, it will show what should be correct. And then the red lines will tell you what is misaligned. So we will help to develop a plan of treatment or update protocols of treatment. It's really exciting. So the applications of computer vision, it's mainly in pose estimation algorithms that use the computer vision to identify key landmarks of the body and some anatomical features. For example, the fingertip, elbow, knee, and we'll use the anatomical landmarks in the same way that we do in the lab now with the motion capture. But you can do that at home, outside, anywhere, really using just your smartphone. However, it's not commercially available yet. So it's promising for the future, and I can't wait to have that largely available. So here, there's some fields that researchers are using computer vision. It's for the typical development of a child in comparison to atypical development. They are also using for performance optimization with athletes, injury prevention, risk of fall, gait analysis, neurological disorders. There are many applications now in the research field, and it's progressing quickly. Here's just some more images that you can not only track body structures and functions, but also activity. To me, the most interesting thing about computer vision in terms of activity is that it's able to capture data and metrics from a person in the wheelchair. So if a person is sitting in the wheelchair, you can still see all the angles. And before, with motion capture, it's not that easy to do, or even with previous technology like Nintendo Wii and Xbox Kinect that you wanted to play, a person in the wheelchair couldn't play because the infrared camera wouldn't read a person if he or she was sitting. And then computer vision can also work in during active tasks, like for playing sports or playing a musical instrument. If you're walking your dog, you can track the movements all the way. But of course, there are some limitations using computer vision outside the lab. Nothing is perfect, for sure. So basically, the problem is that if you were trying to track multiple people at the same time, you can also track people that are in the background or objects that have similar shape, and that can generate unnecessary data with more noise, artifacts, and then that's absolutely a limitation at the moment. And there's also barriers to implement this technology in clinical settings. So some researchers, they ran surveys with clinicians, and basically the answer was that clinicians would love to have this technology, but if it was in a very user-friendly way, like a plug-and-play device. So they basically want a device that you can mount on the wall, and you can press a button, and you can track the data from the patient, and you can press another button, and that can give you beautiful illustrative graphs with metrics telling you what is good, what's bad, and what can be improved. And then in that way, it can enhance the work of the clinician in order to help to design better protocols for rehabilitation or update current ones. So here is a quote from a group of researchers from 2021 that's basically acknowledging the gap that exists between the engineering field, the computer science field, and the healthcare field. I think that both fields acknowledge now that we need each other. So the engineers are building all this amazing technology, but there are no applications for that, large applications for that. And the clinicians from the healthcare field, they want this technology, but they don't know anything about it. So I think it's time now to unify fields and work together, because the technology is available. There are millions of patients in need of that. So we need that to bridge that gap ASAP. Here I have this research that's the patient's perspective of artificial intelligence. This research was done in France. They ran surveys with over 1,000 patients in France, asking them what were their opinions about the use of artificial intelligence in the healthcare field. And they came up with this very chaotic image here that we cannot see anything. But what I did is that I highlighted the main positive aspects, the main positive perspectives from the patients. And I put here in bullets. So basically what the patient is excited about AI is that it will help in diagnosing healthcare problems. It will provide more accurate data. It will enable remote monitoring, telecare, more anonymous care. It can help to improve the understanding of the patient's status. It can be more objective. It can also enable data analysis beyond human capabilities in a more efficient way, and so on. That's basically the positive aspects that the patients are really excited about it. But then we also have the negative aspects that people are really concerned. And one of them is that the technology will not encompass all individual situations. So, for example, if you have a neurodegenerative disease that will accelerate quickly, like Parkinson's disease, for example, if the symptoms aggravate really quickly, maybe the AI doesn't go fast enough. That's a concern from patients. And of course, the replacement of the machine. People are really concerned that the machine will take over the human, and people don't really want that. They still want the human contact, and they want that the machine can help the doctor, but not really replace it. And they're concerned about that the machine doing so much that can put some caregivers out of work as well. So here are the conclusions about this talk today. So basically the rapid progress of artificial intelligence-based experimental longevity medicine calls for translation now. It's important that there is this bridge between industry researchers and healthcare practitioners, so we can start implementing AI in the treatments. This transition offers new solutions both for patients and healthy individuals. I think everyone will benefit from using AI in the longevity field. Everyone wants to live longer, but with quality of life. Nobody wants to live 120 years old, but with chronic disease, miserable conditions. So I think the idea is that everyone can be healthier, but also living longer. Definitely, longevity medicine encourages multidisciplinary collaborative work. Everyone needs to work together now. It's time for that. And unfortunately, it will take some time for AI technology to be implemented in physical therapy treatments, because the way it's being developed right now is not user-friendly. So people need to think about it and how to commercialize, how to make it affordable. And I think it's an amazing field for new startups and people that really want to talk about it and make products for the physical therapy industry. Thank you.
So thank you, Virginia. It was a big presentation, and I think we have some questions for you and maybe for me. So it was very instructive in terms of research, in terms of biological research, and it was also instructive for development projects and also for startups wanting to deep dive into this sector. So we have a first question from Davan Bafsar, and he asked, it was a great presentation, and how the open API provided by Google MediaPipe are efficient for clinical validation.
They've been trying that. I don't think they are applying that largely yet. So I'm not sure how does that work at the moment. I know that they are using it, but not largely. So I cannot tell if they had results about it.
Yeah, okay. And we have a second question from Bhavan. So he was pleased. So he wanted to know more about gamification and its health implications. So if we could have some precision, maybe we could invite to stage Bhavan. So I would invite him to have more clarity. Okay. I think. Okay. Bhavan isn't here. So, okay, it doesn't work. It doesn't work. So, okay. So it was very interesting, and I have two questions for you. The first question is about ChatGPT. You mentioned ChatGPT, right? The famous ChatGPT, and my question is how this technology could influence positively, obviously, mental health and physical health, in your opinion.
There is some research using chatbots to decrease isolation with elderly people, and also to try to decelerate the progression of disease in Parkinson's. So I think that it's a good application of ChatGPT if it can be used as a chatbot. It can answer questions, it can be more humanized, and it can be a companion for the patients. So I think that will help with mental health. For physical health, I'm not sure how it can help. Perhaps helping to track the progress if the AI knows enough about physical education. Perhaps if it's used in conjunction with wearable sensors, then it can help with physical health. But for mental health, I think the chatbots are a big bet.
For mental health. So as you said, it's more a companion for example, for an elderly, for seniors, than a tool, than a pattern, a tool to spot, for example, patterns for certain diseases. It's finally a tool for discussion to avoid, for example, depression or certain syndromes related to the senior population. Okay, thanks. Thank you. And my second question is about the place where artificial intelligence could be implemented. And in your opinion, what are the best places where artificial intelligence could be implemented, like hospitals, like clinics, in everyday life, with sensors and wearable, as you say? So what's the best place for artificial intelligence in the field of longevity?
I think everywhere. I think AI should be implemented everywhere. I think it will not replace the human mind, but it will combine forces. It will enhance. So now in hospitals, in emergency rooms, they have screens that guides the treatment when you arrive there to help with medication dosage and order of treatments. So I think that will just get better. I think that in the clinical setting, you absolutely help all the clinicians in the rehabilitation field to optimize time for assessment and also help to update protocols and design plan of treatments. And with the wearable sensors, and I think that with the progression of smart clothing, people can use that and track their own data and bring their ready physician or the clinicians. So everything will be optimized. I also think that now we have Auto GPT. We will work basically as a personal assistant. We can do everything for you. If you want to book a flight, they can do that for you. If you need to take medication, they can send you alerts to control your schedule. It can give you tips. It can just be with you 24/7. And I think this technology is just in the beginning. It's getting better and better, more accurate. And I believe that in the future, we'll be there in all scenarios.
Finally, artificial intelligence is a monster, is a flexible tool, is something that you can enhance during the time. And it's very interesting because we see today two types of artificial intelligence. The first type is about the creation, the ex nihilo creation from zero. And some artificial intelligence could create something, could be a creative in a sector and create something from nowhere, And you have another type of artificial intelligence that could create regarding, for example, some existing elements, some existing database in health, of course, for sector. And it's very interesting to dissociate these two types of artificial intelligence. And of course, the future will tell us what is the best artificial intelligence for our sector, for the healthcare sector, but also for other sectors. So, Virginia, it was very, very instructive. I think that the audience liked also your presentation. So I would like to thank all the audience. I would like to thank you also for this amazing presentation. And guys, we will see you for the next episode, maybe on artificial intelligence for another sector. But the longevity sector is full of surprises. It's just the beginning, all this research about cells, about the somatic part of body is very interesting and very promising. We have a lot of research now, but the future is coming. So I would like to thank you all for your presence, and I wish you the best day. Thanks, guys.
Thanks for having me. Bye.
Thanks, Virginia. Thanks, all.
Visit community.eithealth.eu to join our community and shape the healthcare landscape with us. For more such videos, subscribe to our channel.